Okay, we are live.
Where are our speakers?
We are live now. வந்துருச்சு அப்டேட் ஆகிட்டு இருக்கு.
Who is unmute? Swami, can you check with the speakers once? Good evening, everyone. Sorry, there is a bit delay. We are still waiting for another speaker. We have Dr. Rakesh Mishra online with us. We are just waiting for personnel. and then we'll be starting. Sorry about the delay. Or probably what we can do is we can start, and once Professor Hasnan is joining, then he'll be online also. So very good evening, everyone. And this is an effort which came into existence when me and Dr. Anand, who's also my partner in crime, in last year when we were discussing, because in lockdown, there was nothing to do wet lab. So we just started discussing things that what we can do for Indian researchers in the terms like saving their time, making them more efficient. So the idea of Empowering Science Foundation came into existence. And what we also were discussing, that there are some pitfalls in Indian research community which can be fulfilled, and there comes the Empowering Science Foundation to fulfill some of them. And what we believe is that all of you also will join on boards, and we'll be a great family. As my grandmother taught me, Janani Janma Bhumishya Swargadipya Garyasi, which means mother and motherlands are superior even. So why not we can do something that, because one thing which is obvious and everyone acknowledges India's contribution to research field, not only in India, but in abroad also, because we also believe in Vasudev Kutumbakam, which means the world is one big family. So we believe in Make in India, and what now, which is our tagline also, that breaking the barrier. What we are, how we are breaking this barrier is that there are some few lacunas in the research community in Indian continent, which can be fulfilled easily, and few of them Empowering Science Foundation targets to fulfill. Just to name a few, it's like stress management, career counseling, capacity building, and you will be hearing much more about Empowering Science Foundation during this inaugural meeting. The one thing which we have already started, and today is the first day, like from now you can do, is we are building up the plasmid repository. Today we have two fantastic speakers with us, and trust me, you'll believe that they have lived their life to set an example for us following breaking the barriers. Our speakers for today have proved it in more than one way. They have trained their students very well. They did brilliant science. They have served society for more than a couple of decades now, and not to mention publication, because if you are in research, publication is the key to it. Building nations stronger than with their efforts. And I'm sure you all will agree, whosoever is from the research background, that there will be plenty of sleepless nights. Our speakers believed and proved that breaking the barriers is the way forward. Although both of our speakers does not need any introduction, still following the rituals, I would like to introduce them to you. Disclaimer from my side, they are way more than I can express in words, or I must say that the actions and the serving spirit of both our speakers is beyond any explanation. First, I would like to introduce our keynote speaker, Dr. Rakesh Mishra. He is presently the director of Tata Institute for Genetics and Society in Bengaluru, but he recently, he was former director of Center for Cellular Molecular Biology. And this is an institution which it's not just eminent in India, but it's known as worldwide. And you can understand that how much depth he brings to not only the institute, but to the research community. Dr. Mishra has worked around the globe. He was in University of Bordeaux, France, St. Louis University, USA, University of Geneva, Switzerland. He is, in the true means, is a multidisciplinary scientist. To mention few of his areas where he has excellent research record and have given the path to the researchers in there. He has done a lot of work in chromatin organization and regulation on Drosophila melanogaster, antisense oligonucleotide mediated knockdown against protozoan parasites, and genomic of non-coding DNAs. Apart from that, he has excellent administrative and managerial skills, speaking from my own experience. And Dr. Mishra is also a JC Bose National Fellow, and also Fellow for Indian National Science Academy, Indian Academy of Science, and National Academy of Science in India. If I'll keep on mentioning all of his achievements and honors, we need a full meeting for that, trust me. So without a further ado, I would like to welcome Dr. Mishra to give the keynote speech. Thank you very much, sir, and welcome. Yes, sir. You can go ahead, sir. We can't hear you, sir. Host, you can. Sir, you're good to go, sir.
Yeah, okay, because thank you, Raja, for the very exaggerated introduction. And I'm really happy to be part of this very innovative effort that you guys are making in form of Empowering Science Foundation. I will not take much time, but I'll just like to highlight the relevance and importance of such entrepreneurships in the current situation. As we have seen during the pandemic, in the beginning, we were in very desperate situation that there was no kit available and to do enough testing. And even if the kit was available, it was very expensive. The tests were costing 4,000, 5,000 per test. And a country like this, where you have to test millions, is simply not possible. So that was a huge shock. And as we started to struggle to assemble our own kits, so CCMB was one of the first institutions to start testing for the COVID in its own labs. And we were recognized as a validation center, national repository. So we had all the administrative means, technical and scientific means to validate new kits, but there were no kits to validate, because to make a kit you need reagents. Reagents were imported. We realized that how even simple things were all imported because of the money profitability. We had gone into very unsafe domain of dependence on other suppliers. And when the pandemic is in the whole world, everybody wants first for their citizens and then give to somebody else, because it's question of life and death. Even kids would come, if we ask for 20, they will give two will go to Chandigarh, two will go to Chennai. I mean, we have gone through very crazy situation at that time. But today, instead of 5,000, the test will cost 50 rupees. So that's the revolution that has happened in less than 2 years. Almost every component of the kit, all the way from amidites, which make the oligonucleotides, and the probes, everything is endogenous, 100%. So, which means that, maybe it's become a little bit less, but there was a time when India was doing a million tests a day, or maybe more, and it was even more was possible. So, which means very quickly we have changed from total dependence to total self-reliance. And not only that, most of the items used for COVID, whether it's the testing kit or PPE, all these things for which were 100% imported, now we are exporting as a country. So not only the technology, but even the production has gone up, and that's where the role of industry and private sector has come. I just gave this as an example that how so relevant it is, that certain things we cannot, we think that we are importing it is cheaper, but then your dependence becomes so much that you start to get exploited, and you start to use what somebody else wants you to use and not because you need it. So those are the distortions that come if you are not doing things on your own, if you don't have self-sufficiency of crucial things. In this context, I think it's very, very important that the entrepreneurs and the startups and young people come forward and do something which not only meets the immediate need of the society, but it also secures future, allows innovation to go full flow. Because if you don't have reagent, what research you will do? You will wait till custom clearance happens or somebody does this, that. Is a huge process to import those things. And of course, you pay cost, same reagent. In fact, we have experienced that same reagent that you buy it for 1 lakh, equivalent amount you pay in, if you are in the US or Europe, is half of that. Very simple. So you are exploited because you don't have that. So I think in this, and may also the thing is availability. Many times you may not get. Your institution may have import restrictions. You may not have money to import things, even if it administratively it is allowed. So therefore, availability of reagents within the country for advanced, sophisticated biology research is extremely important. That's going to be what we are going, if we are going to be a strong country, developed country, are going to be a dependent country and weak technically, because we'll not have resources to do research what is required for our own social needs. So in this process, and also biology is having increasingly powerful impact in almost all aspects of life, with the healthcare, with the agriculture, and so many other, I mean, lifestyle things are going through tremendous change because of the new technologies that are emerging. And so therefore, for doing regular research, if reagents are available, I mean, we have worked in other countries, you just make a phone call and reagent comes next day, if not the same day, to your lab, and you can do your things. Here, ordering something is not a very pleasant experience, because you have to go through so much of a process. But the same thing, if you want to buy now a mobile phone, it's not that very difficult, because it's available now, it's made inside. Or you want to buy something which is manufactured here, like clothes, dress, other items, other electronics, they've become easy. Those were very difficult 30, 40 years ago. So similarly, we have to make a change that doing biology research is encouraging. Reagents are available off the shelf. You make a phone call, it reaches you next day. The quality, all those things. If it is has to be there, then we have to have entrepreneurs who take the responsibility, make those things, create those things, or collect from other places and catalog them properly and supply. And I think this goes in a long way. So, and this particular event that we are seeing today, where the plasmids or constructs can be given to people with a reasonable cost, I think it is a fantastic idea. So it does two things. A, you don't have to import things, and B, you don't have to construct everything that you want. It may take you 1 month to make a construct, while you just ask them, it comes and then you save 1 month time. So, which is a big advantage. And this also removes some of the inhibitions that you don't plan something because you have to do a lot of work, base work. Here, if the concept is available, you can go ahead and do your experiment. So I think the initiative that Empowering Science Foundation has taken is going to set an example of how indigenization of various resources and consolidating, pooling of some scientists may give their plasmid constructs free. Most, I think, will do. Some will give little fees and give and whatever. But in the end, I hope it will be a large collection of plasmids and constructs and expression vectors and various other things which are routine tools in biology. And once it becomes available, then small colleges in remote places can do those experiments and results and get results quickly, which they will otherwise not do because it's not available. So it will lead to much more innovation and discovery of new things and products. And we have to take steps that research is not done in only few places which are empowered administratively or financially and do things. Most of the time when you talk biology, you will take name for 5-6 institutions. The country of this kind, we have to have several hundred such institutions, and these are the efforts that are going to make those needs met, those dreams come true, where a reasonably set degree college where science is taught, these plasmids can be used and experiments can be done. So if something is available locally and at a reasonable cost, you don't have to import, then lots of things can be done. So availability of the material will be a game changer for both teaching and research field in smaller places. Bigger places can still manage, but smaller places, and which is why I think this is very, very important, because it will make the hidden talent express in terms of research activity. If several such initiatives are taken, if we don't have to import all the restriction enzymes, if we don't have to import all the sequencing reagents. So I hope that company like this or this foundation itself will take up new challenges of producing enzymes and selling that some companies do in India, but it needs a lot more effort, and there is a lot of scope for business and also for serving the society and the research community in this aspect. So I'm really very happy, and I wish all the very best and good business, because things will be successful only when you are economically viable. Even the greatest of the idea, if it's not economically viable, it not go very far, and we should not be in the illusion. But business is done in a proper style, that you keep low margin, increase your volume, and build the trust, build your brand, and then move on like any other company. So I hope that a small beginning will lead to a big operation in years to come, because this time of biology and its activity and impact is going to only increase. So with all that, I wish you really great success and look forward to more and more such initiatives from your foundation, and also set an example that many other entrepreneurs and young people, which we have so many plenty in the country, take such challenges and do such innovative business initiatives. So thank you very much for inviting to participate, and I'm very happy to be part of this event. Thank you very much.
Thank you, sir. It was a pleasure hearing you, as always. And thank you for sharing your vision and blessing with us. And I think few of the points which you have added probably have broadened our horizon, and we will probably now consider to include that in our the scope of our foundation, where we can actually make the endogenous things better and the self-realization also. Thank you very much, sir. Now, we are honored to have Padma Shri Professor Sayyadi Hasnain to give inaugural address and website launch. Professor Hasnain is presently serving Sharda University and IIT Delhi, and he's an eminent field in the field of molecular infection biology, and has worked in most of the areas of molecular genesis, drug repurposing, and dissemination dynamics of human pathogens. Born in Gaya and then explored the world, he also is the one who lived the life by living an example and setting it, like breaking the barriers. So one thing which I must say about it, he has worked in world-renowned universities like IIT and institutions like a National Institute of Immunology and he is the founder director of CDFD, the first of the molecular biology thing in India. And he also served as VC of Jamia Hamdard University. And all I can say is he has been VC of more universities than I have attended till date in my life. And there are not many researchers in India who have earned one of the most prestigious award in India, which is Padma Shri. Professor Hasnain is one of them. And I would request to Professor Hasnain to do the honors and to end the wait, which is we are waiting for so many, like at least me and my friend were waiting for almost a year. And now it is up to Dr. Hasnain to do the honors. Thank you very much, sir.
Sir, you're on the call.
Yeah, I'm listening. Yeah.
So we can see the slides.
So you tell me when I should.
So you are good to go, sir.
Okay. Thank you so much for inviting me to this Empowering Science Foundation lecture. This was a wonderful mail that I received one day saying that there are somebody by the name of Empowering Science Foundation is actually planning to create a repository of plasmids. And I thought it's a great idea because this will now enable people like us to get such facilities, such provisions in India itself. And that is why when this invitation came, I immediately accepted it. And I'm here today before you. My apologies, there is some hiccup. I do not know. That's where technology tends to beat you up once in a while. I've given so many Zoom meetings. Yesterday itself, there was a Zoom call and there's one tomorrow. But never it had happened that I'm unable to connect. Anyway, if you take a look at my first slide, I've appropriately titled it as India Needs a Repository of Biologicals. I think you can see my first slide. The second slide, if you can go, actually, the value of a repository is very clear here. If you can move to the next slide, it's very clear. The value of today's and tomorrow's biological collection, it bridges knowledge, the gaps, and also accelerates discovery across a wide range of fields. And today, the one field which is completely overtaken and overwhelmed all other fields, it is I'm getting an echo of my own talk, but anyway, that doesn't matter. So that is the COVID area. So it also is important because it inspires a sense of surprise, curiosity, and connection to nature. It provides a fundamental underpinning for a tremendous amount of basic biological research and helps scientists predict and respond to a rapidly changing world. You know, in India, back when I had just arrived from the US to join a position at the National Institute of Immunology as a scientist, around a few years before that, there was an attempt made by the CSIR to set up what was then known as CSIR Center for Biochemicals. This was in Mall Road campus of the CSIR. And this Mall Road campus, the CFB, then got renamed as CSIR Center for Biochemical Technology. Subsequently, it was renamed again and reinvented itself as an Institute of Genomics and Integrative Biology. The original scope of the CSIR Center for Biochemical was to provide enzymes, provide reagents, provide plasmid. Of course, it worked with a limited success, but maybe there was no science involved, so the people who were directing it did not find much interest in continuing to run the place. But today, if you look at it globally, there is one agency, which is here in my slide right now. If you can go to the next slide, the American Type Culture Collection. And the American Type Cultural Collection also now manages the BEI resources. I get a lot of my resources, biological resources from BEI. And all I have to do is to simply pay them the charge for shipping and clearance of custom at my level here in India. And it's the ATCC is today the largest culture collection in the world. Over 80% of the ATCC customers come from academia and industry, of which almost equal are from the universities and colleges, and equal percentage comes from the private industry. Today, the BEI courses is doing almost similar thing, and particularly in the context of COVID, I think it has some restrictions on what it can send, what it cannot send. But by and large, much of my TB work has benefited a lot. And all I had to do was to simply acknowledge them, my acknowledgement that these plasmids or these cell lines or these cultures were procured from BEI resources. And if you move to the next slide, India, with a population of 1.3 billion, we are very happy that today we are the world's third largest publisher of scientific engineering articles in the world. This is 2018, and this number is increased further. We also have a very heavy burden of both communicable and non-communicable diseases. In fact, India is emerging as the diabetic capital of the world. It is already the capital of TB in the world. The largest number of TB cases in the world are based in India. And that is something we need to worry. India certainly needs to create a modest beginning to establish a biological repository. There are repositories available in India, and including the Cancer Biobank, which is a very specific mandate. The Institute of Liver and Biliary Sciences, I was chair of the committee where we had a big time budget for this ILBS liver disease biobank. And this also is one of the best managed liver disease biobanks available in the country. And a separate, everything is directly decentralized. Then there is, of course, a NIMANS brain biobank. The Orbo, which is also a big thing in Delhi, particularly the one located in Safdarjung Hospital and also at the All India Institute of Medical Sciences. And of course, the National Center for Cell Science, Cell Culture Science, the hybridomas and other repositories are available. And back a few decades ago, we also established a microbiota repository at the Jalmar Institute of Tuberculosis and TB Research at Agra. But what about plasmid? What about DNA library? What about important reagents that we need for expression libraries? None so far in India. And that is where you have to reinvent the wheel yourself. Believe me, when I simply order the reagent from BE courses, I'm saving close to 3 to 6 months of my time. And that is the reason we could publish in the state-of-the-art journal. That is that we have. So what are the utilities of this? Routine work, it helps. Epidemiological work, to monitor disease outbreaks, it helps. Research work, of course, in academic organization, research institutions, it's a big help if we have such a repository dedicated to plasmids and others. The benefits are enormous in clinical practice, better screening, diagnosis, and treatment match. Drug development, newer or better medicines match to patients. Ethical credibility, increased credibility, and support for R&D. And of course, time saving, which reduces the time of research. My own experience tells me it really takes a lot of our time so that we could stay competitive internationally. And of course, a health economy, better public health, and improved outcome. Let me now spend the last few minutes on the COVID disruptive challenge. COVID is one disease which has really been able to create a brand new paradigm, very much like a disruptive challenge to humanity, to a collective human intelligence. COVID-19 is almost 2 years old. The story is 2 years old. Of course, this has now completely changed. It's changed the lifestyle, and it continues to change the lifestyle. It continues to make us all very different in the way we conduct ourselves on our day-to-day life. If you look at this map here, not a single place of human habitation is free of COVID. That is a typical example of what we have been taught in our Vedas. Vasudev Kutumbakam, the world is a family. No other disease, no other calamity, no other world war, nothing has united the world like this ever before, like COVID has done. The intensity may vary. Some places are much more intense in terms of its activity. Some places are less intense. But there is not even a square inch of land where human habitat lives, which is not affected by COVID. And today, if you look at the next slide, this is a very important slide because I'm not going to go into the details of this slide. I'm going to just tell you a summary. When the first coronavirus was reported, after that, there has been a series of mutations in this coronavirus. In fact, I believe, and not just me, who have been working on coronavirus, believe that this virus is perhaps the most intelligent virus known to human. It has beaten human intelligence. Such a small circular RNA virus can do such dramatic things to human physiology and human pathology. Unbelievable, really unbelievable. And the worst part is, every week or every 10 days, there's something new it offers in form of knowledge. We believe this is what it does. Tomorrow we find new evidence to say that, hey, it does not just do that. It does something totally different. And today, this was a paper that we published a month or 2 months ago in Nature Medicine, where we showed that the variants of concerns emerging in India, particularly variant, it has now completely changed the way infection and treatment is going. Today, of course, there is an epsilon variant has come out, which has now been declared as a variant of importance. After that, it will be moved to variants of concern. It will not move to the status of designated as variant of concern. But the Delta variant that was discovered in India has been the single source of the high morbidity and mortality and new spate of infections that the world is witnessing today. And this is something we already characterized, and we already described this in a series of research articles that we published, about a dozen papers we have published so far in this area, including a recent one that we have just published in International Journal of Molecular Science. So what can we do about COVID-19 repeat attacks? SARS, it can find or blind spots. This virus, SARS-CoV-2, it can find vulnerable people. It can find areas where there's high transmission. And all this despite our best of efforts. In fact, people are wondering, is SARS coronavirus 2 actually that smart? Or it is just that humans are tragically stupid? I do not know which one is true, but I certainly do believe that the SARS coronavirus is far more intelligent. You know, I was giving this kind of a work to a public audience. They said, how can you say virus is intelligent? Does it have a brain? And that is something we get started asking. It does not have a brain, but yet it is far more intelligent than human brain. It knows no matter what system we have put in place, the more important thing, the most is that the entire system must be flexible and be ready to take on whatever challenge in whatever form and shape. This is no doubt a very smart virus. It can transmit when we are not aware. And quite often we just become very, very unpredictable. We don't even want to prepare ourselves. That's where the leakages in the community and public participation becomes very important to control the virus. And in fact, although we have new information about the coronavirus is coming up almost on a weekly basis, look at any issue of New England Journal, any issue. Look at any issue of the Lancet Group of Journal. You will not find less than a couple of top papers in these two journals. Leave aside the BMJ, the Nature Medicine, the Nature, all kinds of top journals. The most critical part is sharing of not only unpublished information, which has happened. People are saying in India, we could have done much better had the unpublished information been put in the public domain. I'm going one step further. We should also put the biological resources we have created in the public domain. Our laboratory works on coronavirus as a small activity. Just about 10, 12 people less than that are working on coronavirus in my lab. But believe me, when we wanted to get a positive control for the coronavirus, still we have not been able to get because so much of paperwork has to be done. Why could we not have had this available by request? And I could have simply gotten it. And that's where what this Empowering Science Foundation is doing is very, very laudable. And I really want to salute them. They are making serious attempts to create this. We have to race against time. The third wave of COVID-19 is feared as a wild card. The jury is out. We don't know if the third wave will indeed come or not. But today, when I was in IIT, I was told that there has been a large number of incidents in the last couple of days at IIT, and people are worried. Is this the beginning of a third wave in India? I do not know. I hope not. But COVID has certainly changed the world we live today. What will happen tomorrow is unpredictable. SARS-CoV-2 and the future pandemics will keep us busy for years to come. When I say future pandemics, one thing is for sure, SARS-CoV-2 is here to stay. Whatever we may say, whatever vaccine we get, the new variants, the new mutants are there to come, and they will continue to make our life very, very difficult. And there is no guarantee that some new kind of a pathogen will emerge in the years to come. That is where sharing of biological resources will be a big help. And I would like to congratulate the human for this very wonderful talk, very, very wonderful initiative that they have taken, where they have now able to set up a repository. There are a few issues that they need to work out, as Dr. Mishra rightly said. You need to figure out the logistics. We need to figure out the economics. But if anything we can do, including sharing our resources, our plasmid contract, you can count on us, Mr. Anand or Dr. Anand. I'm not sure what is the best way to address you and your team. But we would be more than happy to help you. We have already shared our resources with others, and we would be very happy to share whatever we have, of course, after, so that we complete all those, whatever paper, whatever format. Thank you once again for me. If there are any questions, I do not know if there is a question and answer session at all today or not. But if there is any, I'll be more than happy to. Thank you once again for your time.
Thank you very much, Professor Hasnain, and thank you for your well wishes and support, I think. Now, we look forward for your support in future also. For now, I would like you to launch the website, which will be followed by the website tour by Dr. Anand, who's the brain behind this foundation and is an active person who will be giving you all the tour of the website, how it is working. Dr. Anand, if you can share the screen, and Dr. Hasnain can click on the link. That's when the website goes global. Dr. Anand, you are good to go.
Good evening, everyone.
Seems like there is another technical glitch. And this is also one of the things which I was just thinking, that if we can make something indigenous in a way that people are working on, so that we can beat the technology. Yeah, and we are connected back. Yeah, Dr. Anand, back to you.
Sorry, everyone. So good evening, everyone, and thank you both the speakers for their wonderful words and explaining how important the biorepository which in India and for the future generation. So I would like to give a website tour of Empowering Science Foundation. So you can also see and log in via www.empoweringscience.org. So it's live now, and you can also make use of it. So where you can see the website homepage, and you can see the detailed description about us, who we are, what we do, and what are all the collaboration partnership we are seeking for. And comes to the real idea of this, it's making a plasmid repository. So if you go to the plasmid link, and if you scroll down, there is a detailed menu, which is which you can see regarding the different services related to the plasmid, such as depositing plasmid, ordering plasmid, and making your own plasmid. So let's go one by one. So one major thing is, for depositing plasmid in Empowering Science Foundation is easy and free. So the people who want to deposit the plasmid in our Empowering Science Foundation, if they are the first time user, they need to sign in and they're good to go now. So you can see, to begin your deposit plasmid, so go and click here. So you'll be finding a form, followed by, you have to fill the online form by providing the required information. While filling the form, if you have any queries or any question, you always can email us, get back to us at info@empoweringscience.com or helpdesk@empoweringscience.com. So this most notable thing is, we are right now welcoming only the plasmid that are published for now. Soon you can also deposit the unpublished plasmid. So we are working on the regulatory part of that. So after filling all the information related to the plasmid, so go directly to the submit button. Or if you want to add multiple plasmid, so you can go with add more option and proceeding with the form and filling it. Once the questionnaire is completed or the form is completed, the ESF, that is Empowering Science Foundation, will coordinate and execute the material transfer agreement according to the legal process that in place at your respective institutions. So as soon as the MTA is finalized, we will send you a deposit kit to protect your samples in shipping, and barcode stickers and an envelope which is prepared by Empowering Science Foundation. Now it is almost come to an end and it is very simple. Now attach the barcode stickers to the respective plasmid tubes and place it in a box and use the envelope to send the samples to ESF in a free of charge. Once we receive the samples, we will do a quality control that includes sequencing, digestion, and so on. After the quality control is completed, so your plasmid will be available online. So each plasmid page will provide a complete information about the plasmid, such as depositing the plasmid, the depositing scientist name, the publication of the plasmid, sequence detail, plasmid map, citation details, everything. So while coming to ordering plasmid, so as same how we are going to do in deposit, for ordering also, each and individual person has to sign up, but most importantly, you can sign up only with the professional ID. So as you see, you can search the plasmid or browse the plasmid in our website regarding to interested keywords which you want, either the gene name or vector type, what is the expression type, whatever it is. So it will be popping up like this. When you click on the gene name, the whole information regarding the plasmid will be coming as in details. So here you have all the information which is required for the plasmid. Once you are interested and you are good to go to buy by adding to the cart. So adding to the cart will lead you to the payment confirmation. So it will be in this format. And further, after proceeding with addition to the cart, same ESF will coordinate with the execution of material transfer agreement. As soon as the MTA is finalized, the ordered plasmid will be shipped to the respective labs. So this is the main theme which we are going to do. Apart from that, we also have other services which is provided by the Empowering Science Foundation, such as there are searching jobs and events. So all the life science related jobs, also the events such as conference, webinar, workshop, everything will be posted. And this posting of the job can be carried out by an individual person or a PI or a lab manager or a PhD student, whatever, wherever they want, just by clicking advertise with us advertisement. So you just need to fill the form and just click submit. All the advertisement which you want to make will be coming in this format, and this will be open for scientific community. So all this detailed information, each and every person can be getting in a regular basis. When you subscribe to Empowering Science Foundation, you can enter your mail and you can subscribe it. So every day you will be getting the updates regarding the job and the events and what is happening in the science community in India. So this is the overall tour of the Empowering Science Foundation. But in future, we are planning to set a couple of more additional services to it. So one is will be setting up a biobank for a rare disease samples as well as infectious disease samples. And this empowering science basically will act as a bridge between academia, hospitals, and industrial collaboration. We also going to participate in capacity building programs for those who for the life science students, and also the internship will be carried out soon. The one thing which I want to mention here is the depositing plasmid will be go on live from today night, and the ordering plasmid will be starting from January 2021. And last but not least, we have a special mention service here for everyone. So whosoever it's from life science field, we have a psychology counseling section. It is completely free for everyone. So just you need to mention your name, email ID, phone number, and we will be receiving the mail, and we will be getting back to you as soon as possible, and our psychology specialist will be contacting you. This service is completely free for all the life science candidates. So this is the end of the tour of the website with the quote of Mr. Ratan Tata: if you want to walk fast, walk alone, but if you want to walk far, walk together. So we are looking forward for the collaboration and the support to serve the research community in India. Thank you very much.
Thank you, Dr. Anand. And as we were talking about endogenous and making our Make in India thing. So one thing which Dr. Anand again suggested was when we are sending this plasmid deposit kit, we will send endogenous seed, which they can use in their house and can always remember Empowering Science Foundation to bringing flowers to their life also. Now it is time for vote of thanks. And on behalf of Empowering Science Foundation, I would like to extend my heartfelt thanks to both of our speakers for gracing this event and the invitation, because when we were sending this invitation, we were very, we were not sure that how we can approach this because we are just starting this up. But the way they have graced us, the way they have responded, I think is way overwhelming for both of us. And the participants, you are the one who have to join the family and to be on board and to make the saying come again into the life that Vasudev Kutumbakam. We all will join our hands to make not only Empowering Science Foundation a success, but to become more collaborative in research communities. And I would like to specially extend my generous gratitude to Padma Shri Professor Sayyid Hasnain. Even he actually, see, you all have experienced it, that he faced the technical glitch, but still he said that no, there is no barrier which can stop him. He broke that barrier and gave his talk over the phone, if you guys have noticed it. Thank you very much, sir, for honoring us and your guidance. I extend my heartfelt thanks to Dr. Rakesh Mishra, which has given us so many new ideas, which has broadened our horizon, and probably now Empowering Science Foundation will start working towards that. We all are inspired from your words, and because there was no option for Q&A in this this meeting, but let me tell you that we will be hosting one meeting every Saturday of every month, where we will be bringing all the speakers from different stages. So so there will be a theme for a month, and then on one Saturday, the person who's delivering the talk can be a master student or just enrolled PhD. The second Saturday will be followed by a postdoc talk. Third, it will be followed by a scientist, and the fourth Saturday, it will be followed by a professor. So we can get the different aspects, all at the different stages of their life, how the researchers looks at the problem. So we'll be starting that also. Thank you very much for all of you to make it in. And last but not the least, I would like to express my sincere gratitude to everyone who has worked to make this website and the development of it. Mr. Rajkumar and Mr. Naval, and all the hard work done by Bharat and Meera. I must tell you this, that sometimes I was too sarcastic. Sometimes I was in a heat because I need to get this thing done. And I was not able to convey my thoughts because I am not the expert in the field of software development. So they bear with me. Thanks to all of them. I cannot finish the vote of thanks without acknowledging my fellow colleagues at Tata Institute of Genetics and Tata Institute for Genetics and Society, and also my friends who supported me in saying that, okay, you guys can do it. And now Anand and me are almost, everyone knows we have common friends and all that. And they said that you make a good team. And that's what we heard from our speakers and our friends. So what I believe is like we all together can do. And then the way when Dr. Anand concluded his talk by Mr. Tata, he is the living legend and we respect him way more than any word can explain. And we are trying to, we can't say that we will be able to, but we are trying to follow his footsteps. And the future of Empowering Science Foundation, there is one very important clause which is not mentioned anywhere in here because the work is still in progress, that whatever money we are earning, 10% of that is going to philanthropic events like supporting the students in rural schools and colleges and the people who does not have access to the technology or to the basic resources. So the kids who can actually fly but are still walking in the crowd, we want to support them to fly, to give them wings with whatever we make at Empowering Science Foundation. One more thing which I would like to say, that everyone in this involvement for Empowering Science Foundation who also came together from different fields and have actually taken this completion of tasks beyond their comfort zone, which was not very easy. I don't know how to mention this, but I'm a person who sleeps at 10, and these people for website woke me up like till midnight, and I was not very happy with that. But today, when I see the participation, hearing from both of our speakers, I realized that that was worth spending our time on that. And now I'm 100% sure that there will be more sleepless night for us also to make this organization, to build it from scratch and then to empower it in empowering the science. And again, going back everything to research, because that is the first motto, but it is not only that one of the things. It is way more than plasmid repository. It's way more than counseling. It's way more than what we say, job search. We see this as now is a one-stop solution for all your problems. If you are in research, you are welcome. You can post your questions, your queries. If you are stuck somewhere in troubleshooting, Empowering Science, info@Empowering Science Foundation is open for you. You can always share, and probably we can help each other and move towards strengthening the nation by performing in field of research. And I would to again thanks everyone and keeping the time on the time, as Dr. Mishra and our Professor Hasnain also said, that time is the key. Time is the key to the success. So I don't want to spend more time on all of this, and it's just 1 minute to be 6, and as we promised, 5 to 6 will be the meeting. So I would like to thank you everyone and open our doors for all the prospective collaborations. If you are a student, you have a query, just please drop a message. Thank you very much. And we are ready to serve to all of you. Thank you very much, and see you all sometime soon.